Welcome back to the DAMY vlog. My name is Dr. David Duizer. Thank you so much for tuning in. I'm a naturopathic doctor and the medical director at DamyHealth.com. On this show, we cover all things holistic health and wellness related. If you're interested in holistic well-being, optimizing performance, feeling good on a day-to-day basis, this is the show for you. Please subscribe to our channel. Today on the show, we're talking about a little bit about my experience clinically in managing chronic disease, in the prevention of future chronic disease events, and in the prevention of the onset of chronic disease in general. So let's jump right into it. My drive in this portion of my career has been fueled by my family history of a few different types of cancer and cardiovascular disease. Because we have been hit with these two illnesses in our family a few times, I've just been pushed into learning as much as possible about the management of these conditions, the prevention of secondary events, and with that, the prevention of primary events for my patient base. And learned a lot along the path of developing my protocols for this space, and have had some success in using these protocols in practice. So today I just want to cover quickly one test we use in the prevention of myocardial infarctions or in heart attacks in particular, because they are awful and they need to be prevented. But there needs to be an active approach to prevention. It really can't just be you have high cholesterol, let's use a statin to prevent a heart attack. It just is not that simple. So the test I like to use, or the series of tests I like to use when someone hasn't had a heart attack before, revolves around blood sugar management, cholesterol management, and the genetic management of cardiac presentations. So usually what will happen, someone comes in with high cholesterol, high LDL in particular, and we need to manage their risk moving forward. Now really that's not enough information to move forward on. So if they haven't had a cardiovascular event before, it's important to go over the main cause of heart attacks in general. And it really is plaque development in the cardiovascular system and subsequent rupture, and that thrombus moving to an area in the heart and causing a lack of blood flow or a blockage. So the way we assess this is a new test to our clinic here called protein unstable lesion signature, the pulse test. Before we had this test, we were doing a few things which I'll cover. This test really has revolutionized the practice and has allowed us to add a missing piece of the puzzle. This test predicts your risk of a cardiovascular event very, very well. It takes a few markers to put that risk together. It looks at inflammation in the cardiovascular system, oxidative stress in the cardiovascular system, blood sugar control, cholesterol in general, and gives us a readout of the potential for a cardiovascular event. It has been developed over many, many years, and it's been clinically studied extensively, and it is a great predictor of myocardial infarction or heart attack in general. So it's for people who are over 40 who haven't already had an event, and it is a very, very reliable test. The reason I like it is it's kind of that holistic approach. It's looking at inflammation, oxidative stress, blood sugar control, and cholesterol to give us a readout, not just cholesterol in general. Before we had this test, we were very focused on risk ratio, so total cholesterol versus HDL. And aside from that, triglycerides, LDL in general, LP little a, LDL particle number, and ApoB100. Now we know that ApoB100 kind of follows the trajectory of LDL particle number. So when LDL is sticky, that's what I'm speaking of when I say LDL particle number. When LDL is sticky, it's really, really bad. When ApoB100 goes up, that kind of predicts the stickiness of an LDL and tracks well with LDL particle. So we use that with LP little a, risk ratio to give kind of a readout, and then of course if there's obesity or metabolic syndrome or poor blood sugar control in general, that's a risk. Smoking's a risk, age is a risk, all these things are risks. Now we can add those scores into the pulse assessment. The pulse assessment looks at A1C, which is a measure of 3 months of blood sugar control. It looks at HDL, and then it looks at a series of other inflammatory markers, which I'll bring up for you and review. It looks at interleukin 16. It looks at FAS. It looks at the FAST ligand. It looks at HGF. It looks at exotaxin, MCP3, and CTAC. Together, these give us a profile of inflammatory response to the cardiovascular system. We respond with this inflammation cascade to heal a destructive pathway. That's why our body sends these cytokines. It looks at hemoglobin A1C, which is damage to the cardiovascular system from high blood sugar, and it looks at HDL. HDL is this protein that takes cholesterol back to the liver to be detoxified. So when we are able to assess all of these measures, we can get a printout for risk of cardiovascular disease, risk of cardiovascular event. Now, ApoB100 is a good one because it's kind of that genetic risk factor, genetically high cholesterol risk factor, which we know is a bad one for cardiovascular events. Triglycerides in general are a really, really bad one for cardiovascular events. So that's an easy one to do, and we can aggressively suppress triglycerides without medications usually. So that's kind of the basis for my approach. Inflammatory markers, oxidative stress markers, blood sugar control markers, and then cholesterol markers, whether it be genetic or non-genetic, lifestyle-based cholesterol markers. After looking at all of those, of course, we're looking at stress and sleep and weight management and lifestyle factor management like alcohol and smoking, for example, to build a proper protocol to reduce the risk of a cardiovascular event. If there's already been a cardiovascular event, then of course the medical profile of initially blood thinners and aspirin and cholesterol suppression aggressively with statins and sometimes beta blockers and other cardiovascular type drugs can be helpful in reducing the risk, and we'll put together a profile using those drugs to manage the risk moving forward and to prevent the next event. In doing so, of course, we're doing lots of lifestyle things with naturopathic protocols that include nutraceuticals, other pharmaceuticals, and supplements in general to reduce risk. We're trying to balance calcium, magnesium. We're trying to pull vitamin D into the bones. We're trying to heal lesions really quickly with anti-inflammatories. If they're not on a blood thinner, we're looking at omegas at the proper dose. Ignore those studies that are low dose. Just ignore them. If they're less than 3,000 milligrams per day of omega-3s, just ignore those studies. They're not worth looking at. We're using like I said, if they're not on blood thinners, using things like curcumin, boswellia, natural anti-inflammatory type supplementation, and then antioxidant supplementation like vitamin C, like alpha lipoic acid if we need to regulate blood sugar. We're doing all of these things in a holistic approach to manage the risk of a secondary event. So that is my kind of thought process and testing around myocardial infarction or heart attacks in holistic medical chronic disease management. In a subsequent video, I'll go over my process in different types of cancer. It's very similar. We have advanced testing that we like to use, whether it be tumor marker testing or inflammatory marker testing in different types of cancers. In our clinic, we're doing VEGF, we're doing circulating tumor cells, we're doing lots of different tests that aren't provided by our province, and we find benefit in those assessments. And I'll cover them in a subsequent video. So that is my process. Thank you so much for watching. Please know, when you're looking at prevention, if you have a family history of a cardiovascular event or cardiovascular disease in general, it's important to manage the basics and then go in depth if you're passionate and if you want to be very serious about this type of practice for yourself. It's not enough to look at blood pressure. It's not enough to look at heart rate. It's not enough to look at cholesterol labs. And it's not enough to look at fasting blood sugar. With modern medicine and modern testing, now we have access to so many comprehensive tests that can contribute positively to these baseline scores and really help you in your prevention of a future event. So let's take advantage of them when we can. Thanks so much for watching. If you love videos that cover holistic health topics, please subscribe. Please have a great day. We'll see you next time.